many women die as a result of wanting to give birth. The figures are staggering. Out of every 100,000 women, 450 die in Ghana. This is one of the world's highest maternal mortality figures. Maternal mortality, simply explained, is death by pregnancy or death by giving birth. And this is one of the saddest things. Now, pregnancy should begin with planning. And that's why I've invited the representatives of Mary Stopes to join me in a look at maternal mortality in Ghana and what we are doing. One interesting thing is that there appears to be a lot of ignorance. People just don't know. And this is further exacerbated or made worse by relative poverty. TV, everyone loves TV. There's a new TV series called the Maternal Mortality Channel. The maternal health is what it's all about. And Mary Stopes have prevented millions, 4.5 million unintended pregnancies in 2011 alone. 222 women without access to family planning. Faustina, you are the country director.
I am.
Antonio, you're in charge of marketing and social franchise. I was wondering earlier on why maternal health need to be marketed, or how you would explain it as social franchise. But let me start with you, Faustina. How would you describe maternal mortality and its key causes?
The main cause of maternal mortality in Ghana is what we call the 3 delays. First, a woman actually understanding that there's a problem in the pregnancy and I have to go and seek, professional help. And then, like places in the north where the roads are so bad and where the nearest health center is like, almost a half a day away, reaching a place. And then the providers, they're having the adequate equipment and the facilities to be able to save that woman's life. That's why our maternal mortality rates are so high, because of these 3 delays.
The 3 delays. One is delay in information, in education. The second is delay in
getting to the right place.
Ability to access the services. And the third delay
is having facilities that are properly equipped to deal with emergencies. And lots of our health centers and our clinics do not have the right personnel, do not have, even fridges that they have the blood bank and so forth, adequate facilities to make sure if that woman is hemorrhaging to death, she can get adequate amount of blood and her life is saved.
I'm going to be looking at blood later on in this morning's edition of Sunrise, but I remember that in 2004 the National Health Insurance Scheme gave access to maternal health for free to all women. So the numbers of women that actually started accessing maternal health care services rose dramatically. Now, why do we still have this many women dying? Over 400 per 100,000. How would you explain that from the marketing or the social franchise point of view, Antonio?
Well, in fact, let me take the opportunity to correct the figure. It's actually 350.
350. Is that good news?
It's actually still very bad.
It's still very bad.
It's still very bad. If you compare it to other countries where, for instance, in the Benelux countries, you would have, about 20 women per 100,000 dying out of maternity. And the UK, it's about 15, isn't it? So it's very bad. But back to your question. Look, I think that it's important that women are educated on the fact that, look, it's just not about having children, and the maternal, access to free maternal health care means that you should just continuously, have children. The issue is that you do have the ability to then access family planning, which would ensure that you space the children. The benefits being that your body is able to recuperate before you go through another pregnancy cycle, in addition to the benefits of spacing results in less child mortality. So those are the benefits. So there's one thing in ensuring that we have a great policy which creates free access to maternal health care, but then we need to ensure that women also do have access to family planning. And I think that's where the disconnect came in. We should have educated women that they do have options in family planning. However, if they do get pregnant, they do have access to good quality family planning and healthcare at the public sector level.
Is there a focus, a main thrust to what you do as an organization, Mary Stopes? Is it family planning or is it maternal health care? Are you looking at advising and educating women and empowering them to be able to choose when they are going to get pregnant? Or are you more focused on, well, you're pregnant, now we're going to help you out with all that you might need?
Okay, no, we're very much into giving women information about choice, all about when do I want to become pregnant, and then we give you information about, you know, how to prepare your body and so forth. And also we're into, you know, when a woman decides, okay, I don't want to be pregnant right now, I want a space and so forth, we're able to give that information about how do you do that. So that's the main focus, is empowering women and men and the youth to make the right choices in their sexual reproductive health, so they don't have unintended pregnancies and that causing, you know, unsafe abortions and so forth.
The Maternal Healthcare Channel is a new TV series. It's a fantastic idea for advocacy, for education. Do you think it would actually lead to action? And, well, since we're talking about maternal health, we're not talking about maternal choices or family planning. How does Mary Stopes fit in? I know you funded this along with the other partners, but why and how do you think it would work along with what you are doing?
We are here, Mary Stopes is in Ghana, first and foremost to help reduce maternal mortality. One of the main areas you can help reduce maternal mortality is having good access to family planning, because 35% of women in Ghana here want to actually limit how many children they have, and they want to space it and so forth. So by not putting extra stress on their body, having to go through repeated deliveries and so forth, every time a woman goes through delivery, her chances of dying is even higher. So we want to be able to give them that choice. And second of all, by giving women family planning, educating them, also making sure they have access to, you know, safe abortion services and so forth, really helps reduce maternal mortality. Because one of the things that actually really racks up that, you know, maternal mortality levels is unsafe abortions. So if we can bring that down, give them access to family planning, we're halfway there.
Because nobody, you know, really thinks about giving birth, to die. You don't think about, well, you know.
You're right, Eric. Look, I think that the whole process of pregnancy and having a child is a joyous one, and it's supposed to be celebrated. However, you know, the dire consequences of not accessing proper health care, proper advice, and even ensuring that you go through your antenatal and postnatal processes and all that, then unfortunately it creates the issue of maternal deaths. You know, and that is why Mary Stopes, through the Maternal Health Channel, would like to educate women, of course, as well as policymakers, on the various issues surrounding maternal health, maternal mortality, so that the proper policies are put into place. And also know that to create access to good quality modern family planning methods, and also to support with the general education. So even if it's not you, at least when you get to the point where you want to access it, you have the good quality information, you know where to access good quality service.
We're talking about information and how it directly links to our choices in terms of our own actions and the way we can access services. I'm looking at, once again here at the figures, and I know you're the guy with the figures. So tell me, is it true that we have one midwife to 1,500 patients, i.e. pregnant women in Ghana, and that we have one doctor to 18,000 patients? So out of 18,000 pregnant women in Ghana right now, there's only one doctor available, and out of 1,500 there's only one midwife.
Eric, it's unfortunate.
It's unfortunate.
Yes, it is true.
How is your message in this maternal channel going to help, you know, the 1,500 women who want one midwife, or the 18,000 women who are all in need of that one doctor that's available?
Well, so that's why the figures actually do show the really terrible situation. However, at least you are informed and you know the alternatives to your health, right? So then, for instance, the one woman or one midwife to 15,000 patients just means that Ghana, really, we need to invest in the sort of training of service providers. It's very important. That's supposed to basically create the anxiety to policymakers that, look, we do have a problem and we need to fix it. If it's either ensuring that the private sector is even involved in the training of service providers, let's create the environment, ensure that we do have good quality measures in place to ensure that the quality of training would benefit the totality of Ghanaians.
Okay, it looks like we've addressed, the 2 Ds, the first one and the third one. What about the second one, delays in accessing services, assuming that they are there, assuming that the knowledge is available at the beneficiary or the pregnant woman's home level. What about the poverty in terms of infrastructure?
Yes.
Supposing you know what you need to do and you've planned your pregnancy and you have a good midwife and a doctor, but there just happens to be a river, 9 kilometers of like low road with a mountain in between, between you, your home, and the clinic. What happens then?
That is a very, very challenging situation, and a situation that a lot of our women are facing. And there's some great innovations going on out there where, communities and district directors and so forth have organized taxis, mobile taxis that you would call and they would come and pick up the women, take them to the nearest hospital and so forth. But there's so many of these initiatives are still very much small scale. They haven't been escalated. The lessons haven't been learned and disseminated. We need more of those solutions, community solutions, not coming from big level, Accra, but actually within the communities to really resolve some of these issues.
What has worked so far? Because I've read about schemes even such as modified bicycle taxis. And Baba Moel Nino joins us online. He writes that some pregnant women die due to the malhandling of the women by young, he writes, nurses when they are to give birth.
I think that there's a lot of issues when it comes to how we train our healthcare providers. First, they're under a lot of stress because, like your statistics, they've got a lot of clients to attend to. And until we actually address training, until we address actually the volume of midwives and nurses that we have in our healthcare sector, we will still be challenged with these issues.
Well, and also
Eric, just one, Antonio. This is for you. Eric, I think pregnant women need a lot of education on nutritional values because it also contributes a lot.
Absolutely. And so that's why I wanted to point out that the Maternal Health Channel is one of the access to good quality information on nutrition. But there's also another intervention, and Faustina pointed that out, which needs scaling up. And Grameen Foundation, one of the partners, has developed what we call the mobile midwife concept, and it's through the mobile phone, where you actually are walked through your pregnancy process. So you don't have to wait till the last minute before rushing. The information is given to you that within the next 2 weeks or so, you probably could give birth. Therefore, you're ready, and those delays which result in maternal deaths are taken out or if you like, that barrier is actually taken out, so that you're able to have a safe birth and all that sort of thing. So there are really great examples across the country. The challenge is how would government support in the scaling up of such interventions so everybody has access to such good quality information and therefore act on it.
When you look at our resources as a nation, do you think that we have what it takes, the capacity perhaps, monetary or otherwise, to ensure that at least women should have the education that would empower them to make good choices when it comes to when they will get pregnant, how often they want to get pregnant, and the sort of services that they can access from the public health sector when they are pregnant and during their delivery?
I think that Ghana is at a crucial point of our development. We're almost at that tipping point. If we can get maternal mortality right in Ghana, I think all else will follow. Economic prosperity, having healthy families, healthy communities and so forth. It starts with maternal mortality.
Getting it right.
Getting it right. We can plan schools. We can plan universities.
Okay.
We can plan our electricity. We can plan our water. But we need to get maternal mortality right.
Yes, we often talk about management, getting it right. Let me put a figure to this, and Antonio, I'm sure you'll be glad to be reminded that our goal is to reduce it by 75% in line with the Millennium Development Goals that have been set by the UN. I understand that there was a conference in West Africa to review these goals and to include actual participants from the field in looking at how feasible and realistic they are. 75%. In 2008, the government of Ghana declared maternal mortality, a national emergency.
Absolutely. Absolutely.
A national emergency. Have we responded sufficiently enough to meet this target of 75%, the Millennium Development Goals?
Unfortunately, no. We have not been. But then I think that kudos goes to our development partners who, for instance, have put a bit of money behind ensuring access to family planning methods. And UNFP is one of our great partners, and some other donors, the Dutch.
The Embassy of the Netherlands.
Exactly.
UNICEF, the coalition of NGOs.
Absolutely.
I've got yours truly, Mary Stopes International.
Absolutely. And we are the service providers, and through our social franchise network, which is, we have about 200 of private providers. All these are part of the strategy in providing access to be able to achieve that sort of 75% reduction in maternal deaths. But you see, there are various barriers to ensuring that we're able to reduce that sort of those high figures, and including access to commodities. Commodities is a big problem, and also information. We're dealing with so many myths and misconceptions, which is also an indication of poor level of education in Ghana. So the barriers.
I'm sorry to interrupt, but tell me some of these. Just give me one or two myths and misconceptions. What are they?
A lot of, when it comes to maternal deaths, a lot of our women still will prefer a traditional birth attendant instead of going to seek services at a registered clinic or Ghana Health Service facility.
Why?
So, why? Because I think that they have a better, closer relationship with these traditional birth attendants.
Oh, they give them better service than the nurses. You're saying they are kinder.
Well, this is debatable. It's debatable.
Okay, we don't have time for debate right now. Our time was all but run out. But I want to ask you this. I asked you about delivering, reducing the maternal mortality rate by 75%. Do we have what it takes to deliver education, effective education in terms of family planning to would-be mothers or prospective mothers?
I think we could definitely do it with the right leadership, and we have so many great people in the ministries and in Ghana Health Service really pushing this agenda. We've got 2 years to give it all. We need our communities behind us, we need the media behind us, we need our partners behind us, and I think it's possible not to get to the 75%, for us to really make that push in the next 2 years. I'm really excited about this channel. It's a great innovation. Is going to get the communities, all of us, talking about this very, very important subject and make sure that we deliver on our promise. I'm excited.
Thank you very much. I've been talking to Faustina Finyami. She's the country director of Mary Stopes International. They save millions of women a year from unwanted pregnancies, prevent deaths, and counsel those that need it. The president has found this important enough to make himself present at the National Theatre at 10 a.m. this morning. He's launching the Maternal Health Channel. It's a new TV series, and it hopes to educate and thereby empower women and all of us in general, men as well, children, to act effectively, make those right choices. Hopefully it would stimulate both policy and programs. It would improve the delivery of health services via education.